Good afternoon, everybody. This is Dr. Rostenberg, and I have a new video, very short, that covers a very important subject in functional medicine. It's not specifically related to MTHFR or COMT or oxalates or other functional issues that we talk a lot about on our channel, but this problem presents every single day in my office, and I want to just go ahead and clear the air around the question of adrenal fatigue. So I'm going to give you several videos of question and answers on this very important topic. So the first one today is simply that, is adrenal fatigue even a real health problem? Because certain patients, many people in fact, do have adrenal fatigue. When they go to their doctor, they are simply told, there's nothing wrong with you, it's in your head, here's a psychiatric referral, here's a psychiatric medication, thanks and have a nice life. I just don't like people being treated that way. So first, let's look at this. This is what the standard medical answer is. I just pulled this up the other day. This is an article published a couple of years ago from Harvard Medical School. And it's basically, kind of a hit piece on adrenal fatigue, saying, simply asking the question, is adrenal fatigue, quote, real? And this is their answer. You can read the article if you want, but basically it comes down to this. The Endocrinology Society and all the other medical specialties do not recognize this condition, and they say specifically that no scientific proof exists to support adrenal fatigue as a true medical condition. Well, I'm going to go ahead and take issue with that statement. I'm going to go ahead and say that's an inaccurate assessment, but I might rephrase their statement and say there is no medication, there's no diagnosis code, there's no CPT code, there's no insurance reimbursable code that exists to allow a medical doctor or traditional doctor to treat someone for adrenal fatigue. I fixed it for you. That's the reason why medicine ignores this, because there's really no way to bill for it. Okay, this is a functional medicine problem if there ever was one. Now here's an idea. This is a test from a middle-aged male using a state-of-the-art hormone test from Precision Analytics. It's called a Dutch test. And it shows lots of data. It shows sex hormones. It shows cortisol levels, metabolized cortisol, DHEA. There's actually quite a bit more data on this test, but this is a summary on the first page. And you can see very clearly, you don't have to be a doctor to understand that this patient's cortisol levels, evidenced by these red lines, are right near the lower range and even drop out of range in the afternoon. That's not normal. That's not healthy adrenal glands. This is adrenal fatigue, everybody. You can see he also has low estrogen levels and he has low testosterone. Now, of course, men are not known or supposed to have high estrogen levels, but there's still a normal range. So on this brief little picture, you can see this supposedly quote-unquote healthy middle-aged guy has low estrogen, low testosterone, and low free cortisol, so he's not living to his fullest. He's not fully healthy. Medicine says this isn't a disease. There's no medication, no surgery, no CPT code, no way they can treat this and get reimbursed, and maybe they're right, but that doesn't mean the condition doesn't exist, okay? So from a medical point of view, there's really two big problems. There's this thing called Cushing's disease, and this is sort of what happens to the human body when there's a phenomenal excess of cortisol, okay? It absolutely just wreaks havoc all over your body. It changes your muscle size, it shrinks your muscles, shrinks your bones, it destroys your skin, it messes with your hair, you don't heal well, you become deficient in vitamin C and other factors because your body's making so much cortisol, it uses up all your vitamin C and all these other nutrients that are required for that process. So if you really want to curse somebody and you don't like them, you say something like, may your cortisol always be high. That will definitely ruin someone's life. So this is Cushing's disease, also called Cushing's syndrome, and it's really a problem in the brain signaling the adrenal glands to work too hard. So this is kind of the medical version of high cortisol. This they will diagnose and will treat, but again, in their opinion, it's pretty rare. The other side of the coin is what's called Addisons Disease, and this is a potentially lethal condition. Not having enough cortisol is what really severe adrenal fatigue is. If you completely run out of cortisol and your adrenal glands stop working, you will not survive. That's how important cortisol is. JFK had Addison's disease due to a back injury. This young gymnast in Canada, I believe he's a Canadian gymnast, very talented human, but also ended up being diagnosed with Addisons disease as a teenager. But you can see with proper medication, they can kind of fix this stuff. So these people and many others who have a failure of the adrenal gland to make cortisol, they have to take cortisol as a drug, just to survive. And obviously with medical follow-up, they can thrive. But those are the two medical extremes. Medicine agrees and accepts that there's people with high cortisol problems, and they accept that there's people with low cortisol problems. But what they fail to understand is that health is a spectrum. It's like you can't just have perfect blood sugar and wake up the next day and have diabetes. You have a giant mass of people who are pre-diabetic. You have a giant mass of people who are, they're not the correct weight, they're not morbidly obese, but they're still overweight. In every health problem, from blood pressure to blood sugar to even cancer and all these other things, autoimmune diseases, there's always a spectrum of health, optimum health, a big gray area, and then finally the disease. And so what I would encourage you to think about as you're listening to this, adrenal fatigue exists. It is a problem. It is a real health condition. And in fact, we've treated, at this point, like thousands of patients with adrenal type problems. It's just part of our world. We have a very, very stressful society. Understanding how the adrenal glands work, how to support them, how to optimize them is absolutely critical in healing and being your best. And so if you're out there wondering what's wrong with you and you've learned about adrenal fatigue and somebody's browbeating you, telling you that, or gaslighting you, I guess, that, no, that's not adrenal fatigue, you're crazy, they're wrong. Okay? Because think of the thyroid gland. The thyroid gland can work perfectly. It can work in a hyperactive mode and be hyperthyroid. It can be underactive and be hypothyroid. And there's all kinds of little diagnoses in between. So medicine sort of breaks their own rule with thyroid. They say, well, thyroid can be overactive, it can be underactive, and it can be halfway active, or it's partially hypothyroid or slightly hyperthyroid. That's what medicine talks a lot about. So I would argue the same thing happens to all of our endocrine organs, and the adrenal glands are no different. So if we use the medical professional's own standard of discussion, if they use the same rules they use for thyroid problems and they applied them to adrenal fatigue, there wouldn't be any question as to whether adrenal fatigue exists. So I hope that was helpful. There's more coming on this really important subject. Stay tuned. And as always, if you have more questions about this, please check out our website BeyondMTHFR.com. Check out the book that we published a couple years ago, Your Genius Body. And give us an email at care@redmountainclinic.com, and that'll get to my eyeballs eventually. So hope you guys are having a great week, and stay tuned for the next episode. We'll try to keep them coming. Thank you.